This video gives us an introduction to healthcare in the United States, and it's a very complicated process. And unlike some other industrialized democracies, we really have a hybrid system as opposed to one national system run by a national government or a single payer system. And there are a lot of misconceptions about the way that our system functions. So we'll take a little bit of a look at the history of healthcare in the United States and some of the problems that have been arising in recent decades concerning healthcare. So if you take a look at the United States, we can define healthcare as being all of the actions that governments take to influence the provision of healthcare services, and the various other government activities that affect or attempt to affect public health and well-being. And that distinction right now, as we go through the COVID-19 epidemic, really is one that we probably haven't thought about in quite some time, if at all, that there is a differentiation between individual healthcare and public health. And that individual healthcare that you might get from your doctor and versus stopping and trying to understand how overall health crises affect us. And that's the image of public health in the United States that we've seen so much recently. Now, in the United States, we have what you could consider to be a pluralistic or a hybrid healthcare system. And this is a mix of public-private interactions where in some cases you might get healthcare from your employer. In some cases, you might get healthcare directly from the federal government through the state, like Medicare for older people, or programs funded partially by the federal government and administered by the states like Medicaid. You might be a federal or a state employee that gets your healthcare through an individual department or healthcare within your federal, state, or local government. And really this public side accounts for over a third of all the healthcare in the United States. And it crosses over a lot of different things. Just a quick overview. When we think about healthcare, we aren't always thinking about this public health aspect of it. But there are really quite a few federal government agencies that are involved in healthcare programs through the vantage point of public health, besides just providing actual medical care. So for example, the Department of Agriculture, very important is that they have food inspection. So our meat and poultry and various other things are examined to ensure that they are high enough quality that people don't get sick. And that certainly is a very important aspect of public health. The Department of Agriculture also distributes food stamps and child nutrition programs. They're administered through that. And that is obviously also something dealing with public health. And then they also engage with consumer education. The Department of Labor, OSHA, the Occupational Safety and Health Administration, is in charge of workplace regulations to ensure the safety of workers and various certain regulations that have to be enforced to ensure that people are not hurt on the job. The Department of Veteran Affairs, also very important because it administers veterans health programs through the Veterans Administration. The EPA is one that we don't necessarily always think of in relationship to healthcare, but when you think about the benefits of having clean air and clean water, having water and so forth that doesn't have pesticides in it and toxic chemicals, there are profound public health benefits to cleaning up the environment. Just think in terms of, when you look at things like pollution and the relationship that many people have asthma as a consequence of that. As we clean that up, the air gets cleaner, and so is our health. The overwhelming amount of money that's spent in the United States on healthcare programs goes through the Department of Health and Human Services. And the two biggest programs that they enforce are Medicare, which is our program for older Americans, and Medicaid, which is our program for poorer Americans. They are huge programs, which we'll discuss at another time. HHS also has the Food and Drug Administration, various other things. And down at the bottom, you can kind of see those things that have been quite important to us in recent months. For example, the Center for Disease Control and Prevention is part of that Health and Human Services, as is the National Institutes of Health, which does a lot of research on health problems in the United States. oftentimes farming that out or working in conjunction with the private sector. So what about this healthcare, this hybrid mix that we have here in the United States? Here's a list of 2019 by the type of coverage that individuals have. This is done through the Census Department. What we see is that we have about 9.1% of Americans are not insured for healthcare, which leaves us with 90.9% overall. Most of these, 2/3, are in the area of private plans, so 66.1%. Most of them come from your employer. We'll see in a couple seconds that the larger your employer is, the more likely that they are to offer you health insurance. Then direct purchase would be just me buying my own medical plan on the open market. And TRICARE is a program that's been set up for military and post-military people as well, that's considered a private plan. Now, public plans, on the other hand, account for about a little bit over 1/3 of all health insurance in the United States. Medicare, which is for older Americans, accounts for 18%. Medicaid for poor Americans and also older poor people on Medicaid. Medicare accounts for 17.3%. And then the Veterans Administration and various other veterans programs account for about 1%. So again, we have about 10% without coverage. We've got 66 to 2/3 percentage of the rest of us are covered through private health insurance. I did mention here that the larger the firm that you work for, the more likely it is that they are going to offer health insurance. So of those firms with 200 or more workers, almost 100%, 99%, offer some type of health care for their employers. When you get down into the realm of smaller businesses, it becomes much more expensive for those businesses to be able to offer their employees health insurance, even though they might have some tax incentives. So when you're looking at those small firms of 3 to 9 workers, less than half offer some sort of plan. Overall, about 57% of businesses in the United States do offer some type of healthcare plan. Now, as a result of the Affordable Care Act, which was passed in 2010, we've seen a rapid decline in the amount of uninsured in the United States, going from a high of about 16% right before the Affordable Care Act down to what we just saw, which was about 9.1%. Most of this is the expansion of Medicaid and various other enticements to get people to buy insurance, and also the individual mandate, which is no longer in force, but did get a lot of people to start getting health insurance. Now, one of the biggest problems that we have is the cost of healthcare in the United States. And if you take a look at the amount of healthcare expenditures in the United States as a percentage of our overall gross domestic product, or what we kind of see as the economic development in the United States, we would see that it's grown from 5% of the overall expenditures in the whole country in 1960 up to about 17.9% of the overall economy. So I provide that in percentage of GDP because the sheer amount of money doesn't make any sense unless you think about it relative to the overall economy. And we see that basically it has tripled in recent decades, and that it makes it very expensive. So part of the problem that we see here is that individuals and families end up paying more, or businesses end up paying more for people as healthcare costs increase. So you see that in 2019, family coverage, usually somewhere between 3 and 4 people in a family, costs approximately $20,576, and individual plans cost about $7,100 a person. So this has been an exponential growth even from 20 years ago as we take a look at this chart. Now, what's interesting here is that these costs typically have been borne more by the employer than they have by the individual. But as health insurance becomes more expensive for private firms to offer their employees, they have shifted some of the cost away from themselves towards the employer. So the light blue in this chart is the worker contribution, and the darker blue is the employer contribution. And as we've seen here, we've moved up to the point at which in 2019, the average worker contribution is now $6,000, which is substantially more of a percentage, roughly about 25%, versus what it was back even in 1999. Now, one thing to also compare this against is how much, if people were making more money, if inflation's going up, maybe this doesn't make much of a difference. But what we see is that the family premiums are far and away above both overall inflation and overall workers' earnings growth over the last several decades. So what we see here is that in 2019, overall family premiums went up by 5%, but workers' earnings only went up by 3.4%, and we had 2% inflation. One thing to be mindful was that was in a really good economy. When we see bad economic times, we see that workers' earnings are less robust. More people are employed now, so workers' earnings have gone up. But in every single year on this chart, since the year 2000, we have seen the family premium costs go up for individuals far more than what they were getting in more earnings. And the final thing, and as an introduction just to some terminology related to health insurance, is some of the things that people are getting shifted over to from their businesses. So this is from 2009 to 2019, or a 10-year span. And what we've seen is that during this 10-year span, overall inflation has gone up by 20%, but the family premiums have gone up 54% for health insurance, and deductibles have gone up 162%. Now, when you think in those terms, if you're getting your earnings are going up 26%, but you have healthcare deductibles that are going up 162% and 54% for family premiums, it means that a larger portion of most Americans' budgets goes towards health insurance, just staying still with the same types of programs that they've had in the past. So there's been this real differentiation here about healthcare costs and the growth of healthcare costs, and that's been a topic of great interest for public policymakers and public health.